On Friday, May 3, 1957, Elizabeth Barlow returned home from work to have her lunch. Few hours later, she was found dead in her bathtub by her husband. It took a whole crew of doctors, pharmacists, and experts from the Home Office of Forensic Science Laboratory to discover that things are not always as they seem to be. Elizabeth and Kenneth Barlow were relatively newlyweds, having been married only 11 months prior to the death. They were living together in a semi-detached house in Bradford in England, along with Kenneth's 10-year-old son, a child he had from a previous marriage. Elizabeth was working in a laundry facility and Kenneth was a state-registered nurse who was unemployed at the time. Outwardly, all seemed to be fine and happy in the young marriage within the home of the small family, and adding to the fact Elizabeth was 2 months pregnant at the time. But as we get to learn more and more from such cases, things are not as transparent as one would like to think. According to the timeline 38-year-old Kenneth provided, on Friday, May 3rd, Elizabeth came home from her job at around noon. She had her lunch, and when finished, she did some chores and washing around the house. At around 5 p.m., she had an early dinner but felt exhausted, so she retired to bed at approximately 6 to 6:30 that afternoon. At 7:30 p.m., Kenneth called her to come so they can watch some TV together, but as he said, she refused, saying that she was too comfortable to move and remained in the bed. At this time, and based on Kenneth's story, she changed into her pajamas, and half an hour later, Kenneth took her a glass of water at her request. At 9:20 in the evening, she called to her husband again to come upstairs because she vomited in the bed, and as he said, they both changed the bed sheets together, and Kenneth laid next to her to sleep. Elizabeth kept complaining that she was feeling warm and her pajamas were soaking wet from sweat, so she decided to have a bath. Kenneth dozed off at the sound of the bathwater running and woke back up less than 2 hours later at 11:20 p.m., but found his wife's side of the bed still empty. Concerned for his wife's well-being, he immediately ran into the bathroom and found Elizabeth submerged in the bath, where she appeared to have drowned. He later told police that he removed the plug to drain the water and tried to resuscitate her by pressing into the abdomen, but his efforts proved unsuccessful and proceeded to call their personal doctor. The family doctor arrived 10 minutes later and found Elizabeth in the empty bathtub in a position simulating natural sleep, with the body laying on the right side. He did not touch her beyond ascertaining that she was already dead. With such an unexpected death, he felt it necessary to call the police, who in turn called Dr. Price, who was on call as the Home Office forensic pathologist. The police who searched the whole house noted that the walls of the bathroom were dry and that there were no signs of splashing water on the floor next to the bathtub. In the hand basin, they found 2 pillowcases soaking in water and stained with vomit. A search to the rest of the house revealed the bedsheets with vomit stains and 2 used needles and syringes, one of which was wet, but no injectable medications were found upon thorough search, and nothing else seemed to be out of the ordinary. Dr. Price arrived in the early hours of May 4th at around 3:30 a.m. An initial glance of the scene revealed no signs of violence on Elizabeth's body or around the bathtub, and the preliminary examination of the body suggested the immediate cause of death had been drowning. But Dr. Price was not convinced. He suspected from the beginning that the death was not a natural accidental death, basing his doubts on few observations he made at the scene. For one, he knew that an accidental death from drowning in a domestic bath upon a previously healthy 32-year-old woman was rare, if not improbable. The second and perhaps most telling fact for him was that the crook of Elizabeth's right elbow, the side she was found lying in, contained about 110 ml of clean warm water, which equates to a small cupful of liquid. This contradicted Kenneth's story that he tried to resuscitate his wife, because if he did, the small amount of water would not lay there intact and warm, and thus made his accounts of events to seem unreliable to Dr. Price. 6 hours after Kenneth verified that he found Elizabeth dead, Dr. Price began a post-mortem examination at the local mortuary. He noted that Elizabeth's pupils were widely dilated and that there was blood trace in the form of froth near her nostrils, her mouth, and her throat. Under the microscope, the samples of her lungs appeared to be bulky, congested, and wet, and revealed fluid retention with small hemorrhages, all consistent with the initial observation that the death was caused by drowning. The chemical analysis of the samples collected were examined by one of the most distinguished directors of the UK's forensic science laboratories, where he concluded that the specimens had no common poisonous substances present. The autopsy results were puzzling to the pathologist. It seemed difficult to him to explain why a healthy woman was drowned, but had no apparent signs of reaction to inhaled water. She was found laying as if she was asleep, and the police and pathologist found no evidence of splashing water near the bathtub, nor any violent signs that could suggest that she was forcefully submerged and fought for her life. With all the results in his hands, Dr. Price concluded that Elizabeth must have been unconscious when she drowned. The fact that Kenneth stated that she was profusely sweating prior to her death and the soaking wet pajamas found corroborated the statement made Dr. Price to take another route of thought. He combined these discoveries with the fact that Elizabeth had vomited and that her pupils were dilated, which directed his thoughts in the symptoms of hypoglycemia. Insulin is a hormone responsible for lowering the blood sugar. An excess amount in the body causes the person to fall into hypoglycemia. But because no such or any other disease were present in her body, he considered the possibility of her being injected with insulin instead. With that assumption in mind, 4 days later, on May 8th, the pathologist performed a second autopsy. On this occasion, and under a magnifying glass, he found 4 injection sites on her buttock. Dr. Price removed the area and sent them to a highly specialized facility that performed insulin tests from tissues. He also sent similar tissue samples from other corpses for comparison. The technique available back then was only performed by a handful of specialized laboratories, and it wasn't as sensitive to trace small amounts of ejected insulin, and so their hopes were not raised at all. Whilst finding no traces of insulin on the other tissues of other corpses, the scientists who performed the test on separate occasions on Elizabeth's samples recovered an amount enough to keep 2 insulin-dependent diabetic patients going for a whole day. On July 26, 1957, Kenneth Barlow was arrested and charged and confronted with the evidence for the murder of his wife. But then his story changed. When Kenneth was questioned by the police, he confessed injecting Elizabeth with a substance but was not insulin. He explained that with Elizabeth's permission and full knowledge, he injected her on several occasions with ergometrin malate, which causes loss of a baby, and that the last occasion he administered the drug was when she came back from work for lunch. What Kenneth wasn't aware of was that samples of urine and tissues from his wife's body were tested in the first autopsy against hundreds of substances, including ergometrin malate, a routine they performed to detect any traces of poisons or other dangerous substances. Additionally, the symptoms Elizabeth experienced were not consistent with the side effects of this drug, but are more apparent with hypoglycemia. And thirdly, as a trained nurse, Kenneth would know the effects of injecting insulin in a perfectly healthy individual, and combining this with the examination scientists performed on the needles and syringes they found in his home, and the site of the injection, which is unusual for someone to inject themselves at the buttock, left no doubt that Kenneth Barlow killed his wife with insulin. The case against him was strong, but it developed into a stronger one with 2 further outcomes. Between the time of his arrest and the trial, a more sensitive technique for measuring insulin in tissue samples became available, and the tests they subsequently performed verified their initial findings. This technique is what was also successfully used in subsequent trials of insulin-induced murders. The only obstacle the highly scientific team was faced with was the abnormally high amount of glucose in the samples Dr. Price obtained from Elizabeth's right side of the heart. But their expertise did not deter them from providing an explanation to that fact in the trial. It was discovered by other scientists that in an event of a violent death, the blood from the right side of the heart has raised amounts of glucose as opposed to the left side, as well as the rest of the body. Elizabeth probably had a very violent death. It was theorized that the amount of insulin injected in her did not kill her, but rendered her unconscious. If Kenneth did not expect that, he most probably resorted to kill his wife sooner by drowning her as she was unconscious, which would explain absence of any efforts from her part to save herself, or any water splashed around the scene. In an article in the Journal of the Royal Society of Medicine in 2007, two experts wrote that if Kenneth had just injected her with insulin instead of drowning her as well, she would probably have been dead or brain damaged in the morning, and the insulin would have been absorbed into her bloodstream, leaving no trace. Prior to the trial, the police also uncovered witness statements from ex-colleagues who worked with Kenneth at the hospital he was previously employed. On one occasion, he claimed that he had found his wife unconscious in the bathtub and that he rescued her by removing her. And on other occasions, he kept mentioning to various colleagues that the easiest way to kill someone would be with insulin, as it is untraceable after death. Well, he was very wrong about that. No motive was apparent for Kenneth to kill his wife, apart from that perhaps he did not want to have another child, or that he wanted out of his marriage, or even both. But in view of the situation, he didn't just kill his wife, he also killed his unborn child. He was sentenced to life in prison, but was released in 1984. During all these years, and after his release, he always maintained his innocence, but forensic science told a very different story.